everybody. My name is Alex Castillejos here in Just Be Blessed. Thank you so much for being here with me here in Just Be Blessed. Today is Monday, Facebook Live. All right, so tonight is a really important topic, and I invite a very special person, a special guest, Tamara Stewart. She's a doctor and an ER doctor, and I cannot wait to just let's talk about this. Everybody's talking about the coronavirus, and seriously, this is not just here in the United States. This is not just in China. When literally it's practically, it's the whole world. And right now, you just take the time and just have a little talk with with the doctor. Here she practiced here in Southern Oregon, and I cannot wait just to hang out with her. And also, if you have some comments or say hi or something like that, please do just say comments, and please share this link, because you never know. This link is a lot of information is going to be, and this is not a news or anything. It's just sit down with a doctor, and I really appreciate her time to be here, going live here in Facebook, and just ask some questions. All right, so let's welcome Dr. Tamara Stewart. How you doing, Tamara? Thank you so much for being here and Just Be Blessed.
Hi, Alex. Thanks for having me tonight.
Yeah, for sure. And I'm so seriously, I'm so excited, for accept the invitation to be here and Just Be Blessed and have a little, a conversation about this topic. It's very serious topic. What do you think?
It's a very serious topic. We have not had a pandemic since the 1980 Spanish flu. So that was over 100 years ago. And so we don't see the things in modern time that they had back then. This is a whole new level, and something that is, I think, causing a lot of anxiety on people around the world. So it's a good topic.
Yeah, for sure. And also, can you please share with us, maybe a lot of people, they're going to see this video and they don't know your background and stuff like that. Can you just introduce yourself?
Sure. I'm an emergency physician. I've been practicing out of residency for over 18 years in Southern Oregon. And I do emergency medicine. So I work in the ER on all of my shifts and have a lot of great partners that I work with. See sick patients from minor colds and broken bones to heart attacks and strokes and trauma. I see it all in the emergency room. And this one is one that's concerning a lot of emergency physicians around the globe.
Wow. Yeah. So can you just, in general, can you tell us what exactly this craziness virus is? The coronavirus.
So the coronavirus is one of a group of viruses called coronavirus. This one particular is the COVID-19, which is the specific name for this particular virus. And it was a virus that originated in Wuhan, China, which probably everybody knows these things by now. Coronaviruses are upper respiratory viruses and the same family as the SARS virus and the MERS virus with the Middle East. They cause a variety of symptoms. The worst being a severe lung infection, which causes acute respiratory distress syndrome and has a high death rate. This death rate of this particular COVID virus isn't as high as the SARS and the MERS virus, but it is a very infectious virus that you can get by droplets.
Wow. That is very serious. Seriously. Wow. I can imagine. So I have a question over here. I have a few questions, but the one is, what can we do to protect ourselves and others?
So the mode of transmission is through droplets. So when somebody coughs or sneezes, those droplets can be extruded across the air and land on a particular individual, or if somebody wipes their nose and then touches a doorknob, or coughs or sneezes, those things can be picked up by another person and then transmitted to that person. And if they put their hands on their face or touch their nose or mouth or put something in their mouth, then they can transmit and accept that virus and get infected.
But it is just if the other person is infected, right?
Correct.
Yeah.
If that person has the virus, the particular virus in that.
And the other question is, I mean, how do you know if the other person's infected? I mean,
that's a very good question.
I mean, you know what I'm saying? I mean, it's something normal. I mean, just to touch your face, you know, I mean, a sneeze or something. I mean, we should, you know, cover, you know, when we sneeze, stuff like that. But I mean, can you imagine? Right. I mean, it's just something like common, you know?
So since the mode of infection is droplets, if you touch a door handle that has the virus on it and then pick it up and put it in your mouth or touch your face in any way, you can get the virus. So that's how you get it. The best way to prevent getting that is by not touching your face if you go out in public, because we really don't know who has it. The incubation period can be up to 14 and maybe even 21 days. And so you could have somebody who's completely asymptomatic out in public who can be coughing or sneezing or wiping their nose or picking their nose or whatever. And you don't know that the person has that particular virus because they don't have any signs of infections at that point. And that's why it's concerning, is because it's very easily transmitted. This particular virus is much easier transmitted than the flu. And yet it has a higher death rate. So we have to be very careful right now because we're seeing so many and exponential rises in it. The best thing is probably not to go out to any major event and stay home, because we don't know who's got the infection out there right now. I estimate that we still, even though we haven't been testing for it as much as we could be, there are people out there who are infected and they don't even know it. And I believe that all over the country, that is the case, that people are getting the infection and they still have no idea because they don't have symptoms yet.
I mean, that's a little scary. I mean, seriously.
But I think that's the whole point as to why they're trying to do social distancing in the country. In other words, trying to keep people away from each other by keeping them at home so they don't do, sports events or church even, and trying to keep everybody at home so that virus isn't spread. Because at this point in time, the exponential rise of the virus is occurring. I've been watching the rise in this country, and we are a few, maybe a week or a week and a half behind Italy in terms of our numbers. And while they have a smaller country and less people in it, that doesn't negate the fact that we're still on the rise. Our amount of infection 2 days ago, I believe, was about 2,800. And as we've been watching it today, we're already up to 4,800 cases in 2 days.
Wow. I'm going to go back to those numbers, but I saw some graphics, and I'm going to show it here in the screen. Maybe you can see it. It was from, it seems like we kind of ahead for from Italy 1 week. And I believe that information, it was last week. And I'm going to just, show it to you. I mean, show it to everybody here. And maybe you can see it, and maybe you can explain to us those death rate or something like that. So here we go.
Yes, that's the graph I was referring to.
Okay.
So if you look at the date, I believe that date was March 14th. If you can see on there the last date on the United States, it shows about 2,800 people infected. Now, this is not the death rate. It is the amount of people that have been tested and are positive.
Okay.
Today, the number of positive tests are now at about 4,800, and that's 2 days. So if you go down to the Italian one and look 2 days later, you can see where they were at. Today, we're about 4,800.
Wow.
Initially, the doubling rate was about every 6 days, and I think we're now about closer to every 3 to 4 days. That means that
Hmm.
it doubles the amount of infected people that are there.
But the good thing is that we had the medicine for it, right?
We do
No.
not have a cure for this virus. There is no cure for the coronavirus. It is an upper respiratory
Mhm.
virus and infection. So most of those we don't have a cure for. They are testing some medications to help alleviate the symptoms, and there are a few out there that they're looking at.
Mm.
But at this point, it is just like every other respiratory virus that we don't have really medications for.
Wow. 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 Okay.
It's a very new virus. This virus has never been seen in the human population before. Before it began in China, in November or something.
Mhm.
Um, and so we don't have any experience with it. And so the companies, both the drug companies and the health departments, CDC
Mhm.
and the WHO, are all trying to scramble out there to try to get as much information as possible so that we can start looking at what kind of medications we can use to help alleviate the symptoms.
Whoa, we need to pray a lot, and we need to, hope that, of course, doctors, they work hard and to find the medicine for this. But so, do you think this lockdown or just be at home is one of the measures, that we can do,
Yeah,
to
so
help?
so it will definitely help. Um, if you see that the transmission is through these droplets, the less amount of time people can spend together, the less they'll be able to transmit those droplets. So right now, the country is trying to get a handle on it because it's exponentially rising in the number of cases that are being diagnosed. And to do that, they're trying to do something called social distancing. We're trying to keep people away from each other. The more people stay at home and not go into crowds, the less that's going to be transmitted. I heard a statistic today, and I haven't verified it, but if one person became positive to this for this virus, for the COVID-19 virus, and then went out in the public and was transmitting it to other
Mhm.
people at the rate that this doubles, and the infection, the easy, how do I say it? The way it's very easily transmitted, the infectious nature of it, because it is so infectious as compared to other viruses, that person would infect by going from one person to the next, 248 people. And with the percentage death rate that this particular virus has,
Mhm.
that means that 2 to 4 people of those 248 would die. So one person can infect 248, and then 2 to 4 of those people would die.
Wow.
So that is the concern, and why the administrators and the health authorities are trying to keep everybody home so that they cannot infect other people. And I think that they're doing a, a rapid job of trying to keep everybody home so that the infection doesn't spread. The problem is that if we have these people that are out there that are coughing on other people and infecting over 240 people per person, which is, a possibility, then all of those people within a week or two will become very sick, and about 5 to 10% of those will become so sick that they require a ventilator. We just don't have the amount of ventilators needed to take care of that many people at once. So we're trying to keep it so that the number of people that are getting infected at one time is decreased so we can take care of them as quickly as we need to.
Okay, so
Does that make sense?
yeah, yes, yes, totally. And I have a so how quickly is the coronavirus result after do you think is tested?
Well, it really is dependent right now on which lab is doing it. The CDC, last number I heard, was able to process the in Oregon alone. The health authority was able to process about 80 tests per day in all of the state of Oregon.
Mhm.
I think that they're really trying to ramp that up, and the president has made some announcements about trying to get all of those laboratories in gear to try to produce those testing agents. But at this point, we are probably taking between 24 and 72 hours to get the results.
I think that's pretty good. I don't know. I'm not in the doctor and the medical field, but
Well, remember,
yeah,
remember, this is really important. This
sure.
is a very brand new test that we're having to come up with in the last 2 months. So we have had no experience with this particular virus or the testing reagents for this particular one. So they're really trying to work hard to get the amount of tests out there. This is a brand new thing, and they're trying to start from stage 0 to try to get these tests made so that we can test people.
Okay. So
So while we're very frustrated, at the same time, we need to be patient with it.
yeah, I'm sure. It's right now in the United States. It seems like it's 63 dead in the whole country. Or
That number just rose to 77
77
today.
today.
Yeah.
Wow, I guess what I read like yesterday or something. I mean, it's different. It's scary.
Yes, it's the information. This is another thing you need to be aware of, is that the information that's coming out from the different authorities is rapidly evolving and changing. So what you may see today may be different tomorrow, and the numbers that you see today are going to be different tomorrow. So it's something that you have to just kind of keep an eye on and know the recommendations.
Wow, wow. So, and the place that you work, how is the how how is the environment?
Are you asking about how we're preparing
Well, preparing, yeah,
or
that's a
what's
good question.
happening in our ER right
And
now?
your ER, I mean, I don't know the atmosphere. I mean, are you guys preparing? I mean, how are you guys preparing in the hospital?
I know that our hospital is having a meeting every day with the administrators, doctors, and nurses to discuss plans and how we're going to handle the influx of patients. I just got a text today that we're going to be increasing. We have a particular amount of doctors on shift at a time, and we are now going to be on call each a day so that we have backup in case it gets terribly busy in the emergency room. So we are increasing staffing. We pulled our tent out, our hazmat tent, so that we can talk about how we're going to do perhaps drive-by testing. We're looking at all the options of how we're going to be able to take care of patients. The one thing that we are seriously lacking all over the country is personal protective equipment for doctors and nurses.
Wow.
All of the masks have been bought up by people in the general community, and we are lacking those for our hospital staff because they are out at the companies that are being purchased, that our hospitals purchased from. So while I understand the concern about people getting infected, if people are able to stay home, that's the best way to keep from getting infected. And just stay away from other people. But your hospital staff, your doctors and your nurses and the other staff that work there are desperate need of personal protective equipment, such as masks and gloves. So try to do any hoarding so that we can actually take care of you, because if the doctors and nurses go out, you'll have less and less people to be able to take care of you.
Yeah, for sure. The place that I work, sometimes we use that mask, and
Right.
the employee is like, before it was a box right there, right? I mean, for anybody just grab it and use it, stuff like that. But now they took the boxes and they say we cannot give you just minutes you want or something like that. If you really need it, for whatever different jobs or whatever, you can have it. But they don't have enough supplies, like you were saying, until May.
Yeah, I believe it.
I
And
mean, I don't
I
know.
understand you need it too. Right now, I think we're going to have an influx of patients. And so we're actually, a lot of the emergency physicians are very concerned about this. And we're trying to ask, the companies and the administration of our country to try to see what they can do to start producing more. I belong to a group on Facebook that is only emergency physicians, and there's about 22,000 emergency physicians on this particular group. And together, there's a lot of commentary. Nearly every post is about the coronavirus and how we're going to deal with this. And we're sharing information across the world with the different countries and with other ER doctors across the country. So we're able to get real-time information about what's happening, which is really good. And together, this particular group has been able to actually influence and discuss with our presidents in the White House some of the information that we're really, really needing in terms of ventilators and personal protective equipment, and they're responding to us.
Wow. Well, that's great.
Yeah,
that's great. Yeah.
It's great.
That's great. Okay, you guys, I know you guys watching right now, and thank you so much for being here. And it's Facebook Live here in Just Be Blessed, and we're here talking. We're talking about this coronavirus. Dr. Tamara Stewart is here and taking, her precious time just to be here and Just Be Blessed and share with us, and I really appreciate that. And you have any questions or something? We're still here. We still maybe a few more minutes, and I have a question for Doctor here. So, what do you think media is handle this coronavirus? Social media. No, not just media,
social
like
media?
news, social media. Because let me tell you, everybody's going to the stores and all. Can we calm down? Or I know it's serious because all those numbers you told me, but sometimes there are some people and.
Well, I understand why the media is trying to get some of the word out. Oftentimes they're always looking for a really good story to make sure that they have a lot of viewers and get the news, everybody hyped up. But while I think that they have maybe done some sensationalism of this particular issue, I think this virus is very serious and needs to, I think that needing to make the public very aware that the social distancing and trying to stay away from other people so that the virus isn't spreading, I think is super important. That is probably one of the most important things that needs to be spread. If you feel like you have symptoms or if you feel like you're sick with an upper respiratory infection, the most important thing to do is just stay home. Don't come in contact with other people. Don't go out to the grocery store, have somebody go out for you, even if you think it's just a minor cough, because right now we really don't know what the actual rate of the virus and people infected in the general public is. So the more you stay at home and stay away and let other people get your groceries for you, the better it is. Don't go out to the restaurants and or any other public gathering at this point, because people are getting infected and they don't even know it yet. So in terms of the media talking about that, I think it's important to address that issue. But at the same time, media always has a hype to it. So
yeah. The one thing I really appreciate that, as a doctor, right? Tell us, or it's out there that this is serious stuff. A lot of people is like, oh yeah, I'm gonna have 2 weeks off. I'm gonna be at home and stuff like that. But sometimes like, no, I'm gonna be in the restaurants. This is nothing and all stuff. But this is serious.
I'm sure that yes, it's very serious. I'm sure a lot of you have probably seen that little graph that shows a very big peak and then a smaller peak underneath it, or trying to blunt the curve is what they're saying. So if you see that there is right now, our country is experiencing exponential growth of those infected with the virus. And while a small percentage of those are going to get very sick, especially the elderly and above the age of 60, or with those with other, other types of diseases such as diabetes and heart disease, they will tend to get sicker. But if you see that right now we're having that exponential growth, in about 2 weeks' time, our emergency room and every other emergency room in the country is expecting a huge amount of patients that are very sick. And we won't be able to handle that. I can promise you, if all the people that we think are going to be getting sick are very, very sick, we will not be able to handle all of the people who are ill. And we don't want that to happen. So what we're asking is, and we're we're really hoping that this social distancing is going to help bring that number down so that we can receive the sick people at a smaller and slower rate and actually take care of them. So that's a really important piece of information.
That's great. So you guys, I mean, you guys watching this, and you hear from doctors saying, "Hey, this is very serious," and this, 2 weeks social. What's it called? Social what? It's called.
Social distancing.
Okay, social distancing, and I
Yes.
think it's so important. That's what she was saying, because if something happened, the hospital, they're gonna have enough room, because it's like you say, it's so common, right? I mean, people get infected, and
They don't even know they're infected. And then 2 weeks later or 1 week later, they start getting very ill. And then they're going to come to the emergency room. So if you have a small cold, if you have a small respiratory
just
infection,
stay
that you're
home.
not very sick, just stay home. The time to come to the emergency room is if you're very sick, if you're short of breath, or if you feel very ill, or for the other reasons of a heart attack or a stroke, or those reasons. Try to keep as many of your family members out of the emergency room as possible so that we can take care of the people that are very ill, because the emergency room needs to be for severe emergencies at this time. And you don't want to expose your family member, especially the elder ones, to any of the illnesses that might be around in the waiting room or other areas.
Yeah, of course. So it is true. Like you were saying, that older people, it get more, gonna get sick. I mean, contagious to coronavirus. Elderly,
They
like
are much
70.
more, they're 60 and above, or those with other diseases. They are much more at risk for getting a severe infection.
Okay. What
And
about?
healthcare workers are also at risk of getting very ill because of the amount of people that they're seeing. So far, we have, that I know of, there are 2 emergency physicians, one in New Jersey, one in Washington, who are now on ventilators in the ICU. One is 40 years old and the other one is 69. There are at least 3 other people, emergency physicians, that I know that are infected. Not in this valley, not in my valley, but
Yeah.
2 in San Francisco. So
Wow.
kind of disheartening and a little bit
Yeah. Yeah.
disconcerting.
Yeah. For sure. So I have this question. I mean, I don't know. I mean, I guess it's not a professional question, but I'm gonna ask you. What if the hospital doesn't have room for enough people? Yeah, I don't know.
That is the
That's a question.
concern.
That's a concern, right?
That is what's happening in Italy right now, and that is why we are very concerned, and we are trying that our administration is really trying to do the social distancing, because I believe, just looking at the information that we've had, is that Italy didn't do that until very late. That even though they were, the media and the government was trying to tell everybody stay at home, they didn't. And now they have a huge peak, and some of the physicians are now having issues with the fact that there's not enough ventilators or hospital staff to take care of these very sick patients. And they're trying to do their best, but they're having to make choices that nobody wants to make.
Wow. Do you know how many people? I heard that it was I don't know, maybe hundreds of people died this past weekend. On
Yes, there was one day just recently that Italy experienced over 350 deaths in one 24-hour period.
Wow. I mean, that's kind of speechless. I mean, just to hear those numbers.
It's very concerning. That's why it's very important for us to do kind of what we're being told to do at this point.
That's why in the United States, and the government, trying to protect the people, say, hey, we need to do this, and don't go out, and no church, no, social events, stuff like that. Because if we don't do that, I mean, we're gonna see those numbers here in the United States.
That is correct. And that's what we're trying to prevent, because nobody wants to go through that. Nobody wants to see that many people die. So try to stay away and try to take care of the elderly people. And, in this time, stay with your family, do things with your family. are not going to work. You can still go outside and take hikes and, go for bike rides, and but also remember to try to take care of some of the elderly people in your life, and so they don't have to go to the grocery store, and they don't have to go to the pharmacy. We can take care of them as well.
Yeah, for sure. Okay. Something to, I mean, I'm sure maybe can be more to talk about, but do you have any something to maybe your final thoughts or something that you would like to share?
I know that people are wanting to try to know how to stay healthy or take care of yourself during this time.
Hmm.
The best thing to do is follow the principles of health. So exercise, um,
Hmm.
fresh water,
Yeah.
8 cups a day, sunlight, good foods. Try to stay away from sugar. Vitamin D and vitamin C in general boost the immune system and help you fight the virus.
Okay.
Um, Antivirals include zinc and echinacea that you can try to, help uh, boost your immune system. Uh, Eat lots of fruits and vegetables, whole grains. Stay away from junk food right now. I mean, obviously, none of these things are going to prevent you from getting a virus
Yeah.
if you actually touch that virus and it goes into your nose or mouth. But to have a healthier individual in general will promote uh, increased ability to fight any type of infection. So 8 hours of sleep, um, trust in God is a really important one. I mean,
Mm. Amen.
um, a lot of Christians, people really trust in God to take care of them. God knows what you need. You follow the advice, you use your brain, you do the things you're supposed to do,
Hmm.
and then some things are out of our control, and we just need to pray and ask for protection. A really important verse that I memorized when I was a child is
Oh,
Psalms
hey.
91,
Mhm.
and it I think during this time of real change that we're seeing in our country, I think Psalms 91 is a great verse.
Mm.
There shall no evil befall thee, neither shall any plague come nigh thy dwelling, for he shall give his angels charge over thee to keep thee in all thy ways. So, faith in God is one of the principles of health as well. And I think that we need to be praying for each other, helping each other when we can,
Mhm.
and keeping ourselves very healthy.
Mhm.
Those are the things we can do. And of course, the most important thing is stay home.
Yeah.
Stay home right
Yeah.
now if you
Like
can.
right now. Yeah. It's so important. I mean, like you were sharing, faith, because in the middle of craziness, like right now, the crisis, it's not here just in the United States, but in the whole world. Of course, we want, the medicine, the doctors, we want to eat healthy, and sometimes, a lot of times, it's like, trusting God, or just to hear a verse in the Bible, what you just share, or pray, pray, and faith is so important in our human life. That's what I'm saying. And
Absolutely.
more, most, right now, thank you so much for sharing,
Yeah,
scripture.
we're going through a pretty tough time that a lot of us haven't seen in our lifetime, and we it's kind of been a bumpy road, and it's going to be a rocky road from here on out too. So if you have not found a relationship with Jesus at this point, now would be the time to do so. He brings peace and comfort in time of trial
Mhm.
and stress, and he loves you, and he really wants the best for you. Um, and so I would encourage that part of your life as well.
Mm, yeah, totally. Yeah, all right, well, we're here, we just had a good time here with Dr. Tamara Stewart. uh, Share with us, she shared with us, I think it's really good information, because I know you hear, a lot of things in social media, and good doctors also. um, but I just wanted to ask her, please, if you want to, take the time right now, and share with us, and I think she really shared more than I was thinking. I really appreciate Tammy being here, and also share, you know about faith. I think it's so important also. Some people here, I just want to say, they're here watching, and Tanya is here to say hi. Sherry, she's here to say hi. Lucia Ball,
Hello.
she's here to say hi. I think
I don't know
Lene,
any of those people.
I know, right? Lene is here to say hi. Some friend of mine says, "What's up, brother?" Jonathan Jones, it says, "Doctor Dr. Tamara Stewart, one of my favorite emergency physicians." That's
Wow.
great. It's a lot. Jocelyn, she's here. Say hi. She put some stuff over here. I cannot read the whole thing because it's gonna take a lot of time. But a lot of good information. Thank you, Josie. Is here. Merlin, Loris Sumter. Good job, Tammy. That's what she said. He said. Sorry, Merlin. Is Marlene is a boy or is a girl? Sorry,
Marlon and Lorraine.
Okay. Okay. All right. Yeah. Whole foods. Eat so healthy, and rest, like you were saying, and trust in the Lord, passion. And activities, water. And try to be at home. In these moments right now. I mean, it's just to be at home. If you're sick or something, I mean, just you stay at home.
Enjoy your time at home. Enjoy your time.
Yeah, yeah, for sure. Oh,
And please pray for your
mhm,
doctors and nurses and other hospital staff as they're
yeah,
going through this
for
trial
sure.
that's probably going to get a lot worse.
Yeah, yeah, and I'm glad you say something about, because sometimes we think about, oh, people are sick and people are, but what about the nurses and doctors that are exposed? And you hear, I believe it was a couple of days ago in Italy. I mean, one of the doctors, uh, he passed away, right? I mean, he get infected and stuff like that, and they were in their 40s, I believe, right?
Well, I'm not sure that one was, but there have been people that have been dying in their 40s as well. So,
Yeah, yeah.
yeah, just try to do your best to help out and, by staying home so that we can take care of the people we need to take care of and not get sick.
Okay, all right. Okay, you guys. I really appreciate you guys here, Dr. Tammy, and we're here. Thank you so much, Tammy, for being here and just be blessed, sharing with us some insights, and so bringing like a serious. Some people like we were talking about. But thank you for being here. Don't hang up.
You're welcome.
Okay, you guys. I hope you enjoyed this interview with Dr. Tamara. Please share this link. All the people that can be blessed, they can hear this information. Please, just to be here, to get more information. And like I said, please listen to. If you're sick, don't go out. I mean, just stay home or social distance, right? And thank you so much for being here. It's a live show. It's a live show here in Just Be Blessed. My name is Alex Castillejos, and we share people's testimonies and uplifting messages and how God is good. And this time, this show, it was uplifting messages. Thank you so much, and talk to you soon. Bye-bye.